Hello, we are Depression in Adults Group 2. Our intervention is The Golden Years Depression in Geriatric Population and Inpatient Care Settings Managing Symptoms Through Positive Psychology Interventions. The members involved in this project are Johandra Hernandez, Kimberline Bercy Davis, Diana Mantute, Domenico Saint-Val, Troy O'Neill, and Jeanette Hernandez. When researching for our topic, we noticed a lack of literature about depression in seniors. Geriatric individuals can suffer from depression, that is, different forms that of younger people. There are many unique challenges that come with old age. One of the biggest reasons we found was loss. Loss, as defined in our project, encompasses various things such as physical loss, emotional loss, social loss, and loss of identity and purpose. These losses are brought on not only by natural processes of the body, but negative stigmas behind age also contributed to how this population can lose their faith and identities. Circumstances such as death of relatives and family, income insecurities, and at times adjusting to restricted life in homes and facilities, all these factors contribute to the development of depression and depressive symptoms in this late stage of life. The intervention that was developed combines concepts from positive psychology and acceptance and commitment therapy. Data and findings from existing studies were modified to be applicable to our target population of geriatric individuals. The following portion will be presented some of the literature that contributed to the design of our intervention. This study in Hong Kong was one of the few that integrated positive psychology as an intervention for depressive symptoms in the elderly population. They focused on two main points as their measurements: life satisfaction and subject happiness. A baseline assessment was done with the Geriatric Depression Scale and Gratitude Questionnaire. The intervention was done in a group setting with open interaction between participants. The sessions were small lessons on various topics in positive psychology with guided discussions about the topics. Activities were done during the sessions and at home integrated the concepts into their own daily lives. The concepts were covered were understanding happiness, gratitude, optimism, savoring, curiosity, courage, altruism, and the meaning of life. They saw a significant increase in life satisfaction and subject happiness after the interventions, and was completed and even continued to be higher than the baseline months after the intervention completed. Rather than only focusing on prevention, many of the concepts that are used in the study can be integrated into interventions for patients with depression.
This article is about the course of depression in elderly patients. This article talks about positive psychology, which is the current trend in psychology that seeks to improve the mental and emotional well-being of individuals, particularly elderly individuals over the age of 60. In this article, the emphasis has been placed not on behavioral challenges and psychological problems, but on the major constitute of a happy and balanced life for people of the age 50 to 79 years old. The research focused on positive interventions that increase satisfaction with life and development gratitude and self-sufficiency among people over 60 years of age. Different types of interventions have been used to demonstrate the signs of depression, such as positive memories, including 3 good things and 3 funny things. The results have showed the improvement in the happiness rate among the individuals who went through the intervention. It has also been revealed that the field of positive psychology is much more effective for preventing depression in elderly individuals than traditional approaches. The study of Mueller, 2005, discussed the importance of promoting intervention which decreases the risk of major depressive disorder. This exam indicates episodes of major depression disorder among individuals of different ages to prove that the oldest group has the highest level of depression reoccurrences due to some health issues, economical factors, and social challenges. Also, challenges requires additional approaches and intervention that should be used for the elderly population. Furthermore, younger adults should also resort to preventive measures to minimize psychological problems in the future and avoid using some medical treatment. The study has proved that elderly patients, in contrast to younger groups, have a similarity level of major depression course. However, older participants have faced a reoccurrence after the treatment more frequently than younger subjects. Therefore, a longer follow-up therapy should be introduced to promote quality interventions.
Loneliness and isolation can have adverse effects on the senior's mental and physical well-being. Several studies were identified with similar intent. These studies were assessed based on 3 criteria and 6 categories of intervention. Social facilitation intervention. This intervention works as a group event that supports the social interaction of a group of seniors with similar feelings of loneliness, much like a focus group. Psychological therapies of this type require support and guidance from a trained professional to lead the group towards constructive interactions. There are also health and social care provision intervention that are geared towards support from healthcare workers and resident students in nursing homes and inpatient care settings. Actions such as visitation from student nurses were implemented to help support the seniors battling loneliness. Animal intervention utilized the support of the canine and or feline as therapy. Interventions were performed with pet owners, and they concluded that pets' attachment could alleviate loneliness by acting as a coping mechanism, possibly by providing social support and companionship. Befriending intervention were based on a person's willingness to spend time with a lonely senior, like Papa Program, where a college student would spend time with the senior, taking them to the doctors or other appointments. Leisure, skill, and development intervention. Those focused more on activities for the seniors, ranging from gardening, volunteer work in the hospital, and even computer training classes. Each of these mentioned interventions was shown to be effective. Most interventions were complex, and many relied on more than one mechanism to reduce social isolation and loneliness. Therefore, it was often unclear which specific aspects of an intervention contributed most strongly to it.
Old age comes with a lot of hardships and losses. Some of them can come gradually, or some of them come sudden. A lot of them are immediate losses, or a lot of them can be losses that happen over time, starting at a young age. Regardless, though, loss in late life is hard, and elderly people don't always take it well. However, some loss or feelings of loss can be preventable. There was a study conducted. They assessed the effectiveness of psychosocial interventions for the promotion of mental health and prevention of depression among other people. 6 groups of intervention were conducted for these assessment of effectiveness. These interventions included physical exercise, skill training, reminiscence, social activities, group support, and multi-component interventions.
The psychosocial intervention had a positive effect on quality of life and positive mental health. These results show that the interventions that were conducted in this study did work in reducing or helping elderly people feel better with dealing with these losses and dealing with the feelings of losses that they had. It also showed that there were ways or things that can do to prevent this. Like they can do like physical activities, they can do skill training exercises to keep their mind going and make them feel like they were young, social activities for them to go out and talk to and hang out with other elderly people or hang out with people of different ages to help them feel happy, to make them feel like they're doing something, and multi-component interventions that included just like a mix of everything. It might have been like being in a social group and exercising together. It might have been skill trainings with a young group of people. They kind of just like fit in these interventions however they see fit and just do different things to see how it helps certain groups of people too, because not every elderly person kind of deal with it the same way. You know, they have to like mix and match these interventions to see which works well with each. The findings can be applicable on the effect on reduction in depressive symptoms in old age. So, like as previously said, these results showed that these interventions did work. However, they just have to like find a certain interventions that fit with these elder people. Like I said, like they just have to group certain ones together to see which one helps better. But it does show that these interventions work. Significant effect on reduction in depressive symptoms were also shown. Social activities significantly improve positive mental health, life satisfaction, and quality of life, and reduction of depressive symptoms was shown. So this shows that social activities were the intervention that worked the most and the ones that the elderly people reacted to and showed the most improvement with.
For my portion of the literature review, I'm going to be speaking about the impacts of depression and how it can affect day-to-day life for the elderly. So, depression is more likely to occur in individuals who are lonely or isolated or may not want to open up or talk about any hardships that they're experiencing or any feelings, which is most commonly seen with the elderly since they don't have many connections or many people to reach out to or may have a lot of time on their hands. So, in the elderly population, depression and being sad or thinking a lot or reflecting a lot on the negative is becoming more normalized. And as we do more research on depression, we learn that it's not a normal part of aging, and it's okay to get help, even though many elderly individuals feel embarrassed to do so. So, depression can take a toll on everyday life, relationships, hobbies, and interests. And the more research we conduct, we notice that depression is more common in older individuals who suffer or deal with other illnesses, such as heart disease or cancer, to name a few. And while we may struggle with depression and there is no cure as of yet, there are treatments and medications given to help reduce the effects that one may feel, such as antidepressants or group therapy.
Literature review: a form of treatment that shows promise. ACTD. One form of treatment that has shown promise is acceptance and commitment therapy, or ACT. A 2013 study used ACT to treat depression in two groups of veterans, one group aged 18 to 64 years old and another aged 65 years old or more. The study found that ACT therapy for depression, or ACTD, had improved patient outcomes for both groups, but especially for the group of veterans aged 65 or more. The study suggests that ACTD can work as a highly effective and acceptable treatment for veterans with depression in a clinical setting. Veterans are among one of the most well-known groups of elderly individuals, and while most people would associate veterans with other conditions such as post-traumatic stress disorder or physical conditions, a significant percentage of veterans also suffer from depression. Patient outcomes in both groups were measured using two metrics, the Beck Depression Inventory 2nd Edition and the World Health Organization Quality of Life BREF. The study also assessed therapeutic alliance through the Working Alliance Inventory Short Revised. 87% of the veterans aged 65 or more completed all of the sessions, and in that group they were measured to have lower scores of depression and higher scores in regards to quality of life and therapeutic alliance, even in those individuals with measured high levels of depression, most likely due to the treatment they were receiving. To relate even further to positive psychology, a 2016 study was conducted using acceptance and commitment therapy in combination with some aspects and ideals of positive psychology to view the results of using acceptance and commitment therapy as an intervention with another group of individuals, in this case, school-aged children. The study found that acceptance and commitment therapy may be used as a viable intervention with the population used in the study, and thus may be a worthy intervention for the geriatric population suffering from depression as well.
These next sections will go over the different sessions of the intervention and the concepts and topics, strategies, and activities that will be used with participants. The aim of the intervention will be to help develop strength and resilience in the participants.
Intervention. Session 1. Living in the Now. The first session consists of introductions between the participants and the clinician, including something as simple as a name and a brief background. The main focus of the first session is education regarding being psychologically present. Participants will be asked what they want to achieve and how they think they can achieve their goals. Participants will be encouraged to ask questions and share their thoughts. Before the first session takes place, ensure that there is written consent for a group session from each individual participant in group therapy. It is also recommended to set rules in place, such as no talking over each other, no cutting people off mid-sentence, and ensuring that the group remains in a judgment-free zone. Encourage that group therapy is a place where participants are encouraged to be open, honest, and supporting of each other, and that judgment of the situation of any individual participant will not be tolerated. The clinician will provide an example as to how to present themselves. For example, I would say, "My name is Troy, I'm 23 years old, and I like talking to people." While the clinician can encourage participants to speak up, they are not required to speak and should not feel pressured to speak up. The clinician will explain what it means to be psychologically present, and explain that while at this time it may be easy to dwell on the past or worry about the future, it is more important to take value in what you have right now. In addition, the clinician should explain about accepting the past for what it is and enjoying the moment. By asking participants what they want to achieve, it encourages them to communicate more, open up more, and potentially even may make them be slightly vulnerable. They may have a specific goal in mind or a general goal. Take both as answers that are achievable in some way. An example of an achievable goal for a participant would be feeling better about themselves when they look in the mirror. Another example could be not dwelling on the past so much. Another example would be managing stress and connecting again with their family and loved ones. Encourage participants that their goals are possible and they are something to look forward to. Encouraging participants to ask questions should help solidify any sense of tension and/or questions as to whether or not they would like to participate in the group. Let the participants know that them being here is completely voluntary and they are under no obligation to be here. However, it is encouraged that they remain not only for their own benefit, but for the benefit of the other participants. Participants may not be happy to be involved in group therapy or group activities, which is fine and may be to be expected. Inform participants that they may leave at any time and do not have to participate in activities they do not feel comfortable participating in. Intervention. Session 1 Activity. In order to create a more comfortable and trusting environment, it is important to have the participants be trusting and open to each other. This activity will involve getting to know another person by pairing off participants in sets of 2. Start the conversation by talking about something that made them happy this week, even small things like a great plate of food or a good episode of a show. If the conversation turns to another topic naturally, that is fine. Nearing the end of the session, participants will be asked to take notes of anything good that happens to them between this session and the next. Positive psychology, as the name suggests, focus on the positives in the life of each individual. By participating in this activity, it allows not only the participants to know each other, but gives them an opportunity to bond with each other, potentially relate to each other, all while initially focusing on a small positive topic that happened recently. This activity focuses on thinking about a positive event that happened recently and being able to share it with another participant. Participants may have had similar experiences take place in the same time period or at two completely different time periods. Either effect would assist in helping the two participants bond with each other. Participants could also potentially be inspired by each other once hearing about the positive event of the other participant. The take-home assignment for each participant is taking notes of any good things that happened between the current session and the next session. Any minuscule thing, such as a delivery arriving faster than expected, or a random phone call or text message that leads to positive feelings, can be taken as notes between the current session and the next session. The notes are recommended to be written down, either physically or digitally. However, mental notes are also acceptable. There is no minimum or maximum amount of positive experiences required. However, participants should try to bring at least one positive experience to the next session they would be willing to speak about if asked.
I'm going to be talking about the second session in the intervention, which is called diffusion. This step focuses on how to get rid of the unpleasant thoughts associated with individuals in this age group. So primarily the goal is to get participants into the mentality or way of thinking that kind of convinces them that it's okay to live in the moment and to simply relax and not dwell so much on the past or the future, because more than likely it's usually things that they may not have control over anymore. And I know that it may be difficult, especially at this age, since elderly individuals may have a lot of time to reflect on what they've lived through, what they've experienced, maybe some sort of regret in their lives or things that they wish they could change. And the goal of this second session is to realize that it's okay to be doing things for yourself and to realize that focusing on hobbies that you used to be passionate about is okay as well. So cognitive diffusion is defined as acknowledging what you're thinking about, what you're experiencing, which is most likely a negative thought or emotion that is affecting you, but not giving it the power or not letting it completely invade your head. That is what cognitive diffusion is. So acknowledging what you're thinking about is great, but not solely just thinking about it, let's say 24/7. So how does one get rid of these negative thoughts? How can someone in this age group get rid of these negative thoughts? So the homework that's given to group participants will kind of reinforce awareness of their situation by saying, okay, this is what I'm thinking about. Let me see what I can do about it to think about it less and less. So the goal is to acknowledge the thoughts, but not letting them or giving them the power to completely dictate your head and everything else that you may be thinking about. So it's important to focus on hobbies or interests that you may be passionate about or used to be passionate about, because I know at times when you're thinking so much and having negative thoughts about the past, about the future, that you may be forgetting simple things as things that you used to enjoy that you don't enjoy anymore, because you're not focused on that. You're focused on having negative thoughts. So for example, calling a friend, asking how they are, sewing, crocheting. These are just some examples or some hobbies that could help you. Just keeping your mind distracted for a bit so you're not solely focused on this one negative thing. And the goal of this session serves to lower these depressive symptoms in hopes of creating a more happier life, a life that's, a life where you're more satisfied.
Next is intervention session 3, which is acceptance. This session focuses on the feelings of acceptance and ways to deal with these feelings of acceptance. The treatment that has shown the most promise in treating depression in older adults is acceptance and commitment therapy, also known as ACT. This offers potential assistance for those who have experienced reduced control, loss, or other life changes, which can be attributed to those in an older population, which is not the control group, I assume, in this intervention study. The activity will be writing down triggers, also known as situations, thoughts, or feelings that immediately precede a certain behaviors, what you actually do in these behaviors, and payoffs, which is the immediate outcomes of the behavior that encourage the behavior to continue or to stop. The homework will be to identify self-defeating behaviors with the motivation behind them, which basically is trying to write down which behaviors you're having, what triggers them, and what do you do after you deal with them, or what do you do to deal with them. This is a way to recognize and modify problematic behaviors and learn to come to terms with them and accept them. Completing a worksheet that presents the values bullseye or sets of concentric circles that are separated into 4 quadrants: work and education, leisure, personal growth and health, and relationships. The exercise involves placing an X on the circle that most closely represents how you feel in the present moment. The closer to the middle of the X, the more you feel like you're behaving like the person you want to be, and the further out of the X, the less you feel like the person you want to be. So this is an activity to kind of know more or less where you are and where you want to be, and it can help you more deal with these feelings and accept the person that you are becoming or want to become.
Session 4, Inner Self-Mindfulness. This session will focus on the inner self-mindfulness that will help senior participants on how to be aware and reduce stress and depression. The seniors will be taught a mindfulness-based meditation to help them learn coping skills and be aware of their feelings and thoughts without judgment. The homework will be to find ways to meditate and have the seniors meditate 10 minutes every day until the end of the intervention. The first activity requires for the seniors to do outdoor activities, such as meditation walks outside. However, I know that there's a lot of seniors who don't walk. There's some seniors who are bedbound, some seniors who are wheelchair bound. Therefore, you would find other outdoor activities for them to do in order for them to complete their meditation during the intervention. However, for those who are able to walk, you can have them walk either in a straight line or in a circle for 10 minutes every day until they are able to complete the intervention. And also, once they're done doing their 10-minute walk, you can have them discuss how they feel after they walk. And also for those who are unable to walk, those who are bedbound, you can also have them try a different form of meditation. And after they're done with that meditation, you would discuss with them how they feel afterwards. Another great activity for the seniors to play is bingo. Bingo helps demonstrate coping skills. The game will promote positive mental health. And for some seniors, after playing the bingo, you can have them describe a positive coping skill that they have tried before in the past, and also a positive coping skill that they would like to try in the future. As you can see, bingo is showing different coping skills such as eating healthy, going for a walk, yoga, singing, laughing, keeping a positive mindset. All these things demonstrate positive coping skills. So playing bingo It's a great activity for the seniors to kind of beat depression and become open-minded.
The intent of these interventions is to allow the participants to see their positive traits, to be grateful, and to realize what can make them happy. By allowing the participants to write down their strength, their personal attributes, skills, and character traits will encourage the reinforcement of the positive feeling of self. It can also assist them with their focus on the good things in life, their self-worth, and all that they have accomplished. This can have a lasting positive health benefit and can support with coping with hardship and life's challenges. Positive thinking can increase self-confidence, build self-esteem, and can help to reduce any negative emotions and thoughts. These group exercises reaffirm their strength and bring them out through conscious actions. The participants can have a sense of security through the support received from these group interventions. Participants may feel more in control of their lives. During session 5, we will discuss the positive traits and strength builder of each participant in the group. The participants will each discuss their homework assignment to the group from what was written in their journal from the last session to the current session. However, during this intervention, there are 2 activities that the participants will play a part in. The first activity is to pull some of the messages written in their journal and list 5 things they like about themselves. Self-talk can help improve a person's view on life. This would help the participants think about the way they see themselves. This can also inspire them to continue to be the best version of themselves. The second activity is the Spin the Positive Mental Health Wheel. The Positive Mental Health Board has many different acts of positive thoughts and actions. The facilitator would spin the arrow in the center of the board. Once the arrow lands on one of the positive sections, each member of the group would take a turn to discuss a situation where this applies. When the focus is on the positive things the participants have done, it is likely to help others focus on the positive things they have done. These sessions are intended to boost self-confidence and to have an optimistic outlook on life. By talking out loud about all the positive things can motivate each person to take more control of events in their lives and to achieve certain goals. These groups session typically would allow bonds among the participants and can help with their mental well-being.
Session 6 will focus on values. In our intervention, values are defined as preferences held towards certain goals or actions. The participants will be asked to take the Schwartz Value Inventory Test and observe their top-rated scores. In this session, we will discuss what these human values mean and why the participants might hold these values. By keeping these values in mind, they can learn to eliminate contradictions in their lives, so they can be more authentic and prioritize their decisions around their preferences and values. The activity for session 6 will be a thinking activity that will help them learn to be more aware of the effort and time they invest into making life choices. Oftentimes, we ruminate on whether or not to do something, only to end up dissatisfied in our decision. We think too much about the what if, the missed opportunities, and wasted time. They will be asked to assess the effort versus the satisfaction they feel in each decision they make during the week. The goal will be to have them think about the values and not to linger or overthink about their choices, but to become more instinctive in how they make them. The final session. This session will wrap up all the previous sessions. The participants will go over the activities that were done throughout the intervention and the ways they impacted them. A certification will be given to them to serve as a sort of achievement. They will be encouraged to continue practicing what they have learned and also try to share what they've learned with others. They'll be encouraged to keep in touch with the peers from the group. A roadmap booklet containing concepts, strategies, and activities of the intervention will be given to them. The roadmap booklet will quite literally help serve as a source of direction in case they are to find themselves lost again. This is the end of our presentation. Thank you for watching.